Hi, everyone. Welcome to the free training today. First and foremost, I always want to make sure that I thank you for taking time out of your day. I know you have a lot going on. I know you're coming from different parts of the world. And so I appreciate your time, whether you're here live today or watching the replay. Let me know in the chat box if you're new to these live trainings where you're coming from or what brought you to the group. We'd love to hear about it. I love interaction. And the last thing is that if you see me looking to the side, like I was just now, I'm tracking with my notes. I write a lot of notes to prepare these. I will say this every time because I don't want you to think I'm distracted, but I'm tracking my notes. I prepare for these trainings. I want to make sure I fill it with as much value as I can, and I don't want to get too far off point and kind of stick with what I want to teach you today. And with today's topic, it's really important to me, I think, because as a clinician, and since I've just learned a lot about the history of how we've treated pain. I've experienced myself what conventional treatment approaches can look and feel like, and how we sort of got where we are today after all of this pain history. Why are we approaching pain this way today? And this is something that I'm really interested in and I study a lot. And it's been clear to me that there are a lot of longstanding problems that exist with chronic pain. They've existed for decades. And a lot of these problems can really limit the education and approaches that you actually receive in your conventional treatment appointments. And I think that's sort of what brought me to this place, sort of my mission of wanting to connect women with this education that they're just not getting in those appointments. And one way to think about our experiences and then change our experiences and our narrative moving forward, which is what we're talking about today, is by discovering how the narrative developed in the first place within sort of our chronic pain past, our chronic pain experiences, because this is really where the fruit lies, right? It doesn't lie in your answer on that 0 to 10 scale of how is your pain today. When someone asks you that, there's no way that could possibly make you feel like they are asking you everything you want to tell them or acknowledging everything that makes up the experience of pain. So today I'm just going to kind of offer a roadmap for understanding how your experiences may have shaped your pain, and then maybe how we can sort of look at that and shift it a little bit. But I think you're going to be really glad you bet on yourself today and gave yourself this time to listen to this training and reconnect with the experiences that have changed your pain journey. So just grab a pen and a piece of paper. I think that might be helpful today. Put away other things you're doing, bring your attention back here, and let's get started. With that, I always want to make sure I introduce myself. Of course, many of you know me by now, but I'm Dr. Anna Redmond. I'm a trained clinical psychologist. I have a specialty in health psychology, chronic pain management, and I have a board certification in biofeedback. I'll be with you through this training today, guiding you through this education, available for questions today and beyond. I always make sure to include a disclaimer here that even though I have training as a clinical psychologist, I'm not functioning in that capacity here. Today, I am an educator of chronic pain. This is for educational and informational purposes only, and not to be a replacement for medical or mental health advice, treatment, or diagnosis. Anyway, let's get started. So to me, when I put together all of my experiences and I think about it, what makes up, I think, so much of someone's chronic pain management, their ability to manage their pain, are the experiences that they've had along the way. And so I'm going to tell you what I mean by that. One example of an experience is that your scans revealed that nothing was amiss in your body. So you started to question whether you imagined it. You go to the doctor, they say there's nothing on these scans, and then you're questioning yourself. The cause of your pain was treated, but it didn't go away. So you're mortified. You think your doctor thinks you're making it up or that it's psychosomatic. Like, what are you going to tell your friends now? What are you going to tell your family? Maybe this has happened to you. There's no signs of ongoing damage. They can't find anything in your scans and your labs. There's nothing that can be done from a medical standpoint. Maybe as a last resort, they gave you a referral to a psychologist. And what is that communicating? Am I damaged emotionally? Is this psychological? Maybe you didn't even accept the referral because you're thinking, I'm not depressed, I'm in pain. All of this happens, all of this is reasonable. Maybe your symptoms have felt like a mystery, that they never quite fall into a clean diagnosis. So you keep seeking a medical test or procedure or appointment, anything that you can find that would legitimize your pain. And if any of that sounds familiar, I think what I've seen is a thread of experiences that are really common, that there is really something happening here. And so we're going to explore your experiences with chronic pain, your conventional appointments. We're going to explore that through the lens of the pillars that make up and guide my educational approach. And so the first pillar of my philosophy really has to do with the power of words. So this idea that language is powerful, this is the first part of my philosophy. And so we're really thinking here about how did the words that you were given at the time that your pain started potentially feed into a negative pain cycle. We can explore a narrative here. We can gain flexibility in how we think about this in perspective. We can appreciate some validation here. So I was trained as a clinical psychologist, and I went on to work with many patients who had long histories of chronic pain conditions. And I think that the best skill that was instilled in me during my training was the ability to listen and to hear my patients. It wasn't to treat them, it was to listen and hear and learn. And I wanted every person to feel like they were heard. I wanted them to feel cared for. And I knew that I couldn't fix every single patient. But over time, I really came to appreciate the power of their words, the significance of their stories, the power of the explanations that their providers gave to them, and also my words, how I understood the way they described their experiences, how I was going to help them. So the idea of herding all of this information into a 0 to 10 scale with the doctor really makes me shudder. And the reason for that is because words just carry so much meaning. And that can't all be simplified into a number. And beyond meaning, it all ties back to the link between the mind and the body. And I think of this as happening in sort of two types of moments. When our doctors are sharing, so words being powerful, one, when our doctors are sharing things with us about our pain, and two, when we are thinking about, talking about within our own mind or sharing with others the story of our pain. Because when we hear or say words, they become neurological events. They become part of this circuitry where our brain is transforming them into knowledge, thoughts, opinions, but also more importantly, potentially danger signals. In a conventional medical setting, and I suppose really any other setting, the intentional and careful delivery of words really holds a lot of power, especially when they're coming from physicians who are really at the top of the medical chronic pain food chain, right? Words can activate what we call our dopamine reward system or our feel good center, and words can also activate our endogenous opioid brain networks. And these are like our pain relieving centers that naturally occur within our bodies. And if we aren't careful, when we deliver or someone delivers unhelpful language, it has the opposite effect. It can add distress, fear, and threat to our story, and it can really fuel a cycle of chronic pain. So what I mean here is to really think about words that were triggering for a negative pain cycle or triggering for your brain to be detecting danger. These are things that I've heard people say. You will end up in a wheelchair. You will have to learn to live with pain. This is the worst I've ever seen. You've blown your knee. This is bone on bone. We don't know what this is. Your disc is bulging, herniated, ruptured. Degenerative spine disease will eat away at your spine. These are things that patients have actually heard and told me about. And while these words sometimes can be really common descriptors of pain and diagnoses, and your well-intentioned doctor is really trying to prepare you, these words, the diagnoses, the descriptors, they are language. They still form a neurological event in our brain. It can happen in how we are told to move, how we are told not to move, how we tell others that we should or shouldn't use our bodies. Thinking about all of these phrases and words that I've shared, how do they evoke a sense of safety or threat? And that's sort of one thing to think about, that language is powerful, words are powerful. Now I'd like to dip our feet into what I call the biomedical model, the biomedical world of approaching pain, where perhaps it has been helpful and perhaps it has at times negatively impacted our experience. And so this connects with the second pillar of my pain philosophy, which is exploring this idea that your pain is not just mechanical. Um, and we can dive into years and years of research acknowledging that pain is not just physical, pain is not just biomedical, it is biopsychosocial. And this is the idea that the pain that we feel in our bodies is impacted by biological, psychological, and social factors, beliefs, emotions, social context, coping behaviors, um, our sleep, our nutrition, our anatomy, and our past history of trauma. There are so many things that can influence how we feel pain in our bodies. And astonishingly, there's actually a ton of literature out there highlighting the fact that pain does live in the overlap of these biological, psychological, and social bubbles, and that contextual factors play a role. But even this is decades of research now, even still, providers, when they talk about teach, treat patients, they still really do it from the scope of practice as treating it like a purely biological problem with biomedical solutions after procedure. And so I am not someone who is against the biological approach. I actually very much support it. I just think that when that's the only thing we were doing for pain, then we're missing a big part of the problem because we're only treating part of the pain. If we're only treating the biological, we're missing out on the many other factors that can impact pain. And so then we can only do a limited amount of good, right? So one thing that I learned in my research is that there was an evaluation done around pain medicine curriculum in medical schools, teaching providers about chronic pain. And it was found that in 90% of UK and US medical schools and nearly 80% of medical schools in Europe, there was no compulsory education to teaching dedicated pain science, pain medicine. And this tells me that, again, the people that are perceived to be at the top of the food chain in the medical world are not getting the education that they need to adequately respond in a really comprehensive way to societal needs around chronic pain. And so, how does this affect you and your narrative? Well, remember, the biomedical picture is not the most comprehensive way to view pain. If we only treat pain from that approach, we're missing the other two-thirds of the problem, the psychological and social or contextual factors. And even though we feel it in our bodies, pain isn't just physically in our bodies. It's multidimensional, it's impacted by biological, psychological, and social factors, and it's also unique to you and your context. So, identifying mechanical dysfunction in the body is what conventional treatment approaches have focused on for a really long time. They find the problem, they replace or fix the part, pain will subside, is the idea behind that. That works really well sometimes for acute pain. It doesn't work so great for chronic pain. And it's a really simplistic approach to chronic pain. It's outdated when it's used by itself, and it can cause a lot of distress for the person experiencing it. And this is because pain is not just mechanical. Your body is not a car. You have a mind body vehicle. It's not just a vehicle, it's not just a car with parts to be fixed. Addressing pain is more complex than visiting your mechanic for a fix or a replacement part. So, you know, if you think about just like MRIs, for example, so if someone tells you that your MRI reveals degenerative changes, did you know, and has anyone told you that two people with similar MRIs, with both, let's say, with signs of mild arthritis, could have vastly different experiences? So I think about maybe one person, a basketball player, could be at the height of their career and still playing basketball with mild arthritis, but another person could be just down for the count with severe arthritis pain. And so what it's accounting for these differences, that's context, the brain, thoughts, emotions, experiences. There are so many things. It's not just their body. So when a person is asking us on a scale of 0 to 10, how bad is our pain? It's really dwindling it down to just the physical, the biological, or the anatomy and how it feels physically. And I think we know deep down that pain is so much more than that. The third pillar of my philosophy I want to connect here is this idea that Pain is an alarm system, and the main concept within that is that you will have pain when your brain concludes that there is more credible evidence of danger related to your body than there is credible evidence of safety. Remember, it's your brain's job to protect you, and it's collecting evidence. It's collecting evidence. It's like a detective, and it makes decisions based on the evidence it has collected. Sometimes the brain gets it wrong. Sometimes the brain becomes overprotective. But regardless, when the brain concludes that there's more credible evidence of danger than there is safety, it will produce pain to protect you. So dealing with chronic pain is often about resetting that alarm system to function normally again, to be less protective, to give it messages of safety. Here's a really important piece here is that, for 1 in 4 people, the alarm system will activate after an injury or even just a stressful time of life, and it never quite calms back down to the resting level again. It remains extra sensitive, close to that firing alarm going off level, and it doesn't take a lot of movement, stress, or anxiety to kind of activate the alarm system each time. So you can imagine that for people with a long history of chronic pain and attempting treatment, that there are a lot of factors that can contribute to having an oversensitive alarm system. And I'll name a few here, like failed treatments, chronic stressors, things like job, family, financial, emotions like fear, anxiety, depression, irritability, ongoing pain, deconditioning and disuse of certain parts of their body, guarding their body, um, having difficult encounters with providers, also the language used by providers, diagnoses, explanations of pain, or not having an explanation of pain, that pain is more of a mystery. There are all these different contexts that can play a role here. And just to say it again one more time, you will have pain when your brain concludes that there is more credible evidence of danger than there is credible evidence of safety related to your body. And so the last this is not the last, sorry, there's one more after this. The fourth pillar of my philosophy is that I believe your pain is real, exactly as the way you describe it. When we can get education, validation, sort of, I believe you, right? When you understand that pain is multidimensional, biopsychosocial, and it's unique as you are, it triggers a sense of safety. And so when you get education on how pain actually works, the education around the extra sensitive alarm system, you can start sort of a different cycle of recovery without sort of the inevitable disuse, disability, depression. And this is where all of this comes together in the form of a narrative. And narratives are a really powerful part of our chronic pain experience. They change our brain activity, they alter our emotional state. And I think what's surrounding us in the culture of chronic pain is that we predominantly talk, see, hear, read, treat the physical, the medical. This is the conventional approach to chronic pain that we live in, despite years of evidence pointing to a more comprehensive approach, because chronic pain is something that affects us holistically in all aspects of our lives. It's not just the physical. The web of pain spreads so much farther than a physical sensation. And so, it's important to think about how easily has it been for you to understand, to express, to feel validated around the holistic burden of pain. Have you received good language to understand it with less fear? Have you received information, education, or images that caused you to feel unsafe within your body? When we think about persistent pain, there are so many questions that come to mind. What is it exactly? What is the best way to deal with it and recover? Will I have this pain forever? But then you persevered and kept going. But then how did you get here? What interfered with a successful end to your chronic pain story? Did you experience subtly judgmental communication, lack of empathy, being dismissed, conflicting information? A unifactorial approach to a multifactorial problem. Think about what were the experiences during your chronic pain journey that first showed up as these kind of like small blips, but they eventually became patterns in your interactions around your pain. Did you feel like you had an invisible condition? Some women have the experience that if they look too good, they're not reliable to their doc, sorry, if they look too good, they must not be in pain, or this must not be real pain. And if they don't look good enough, they're not reliable enough, right? There's kind of this weird, what does it look like on the outside? Were you constantly seeking an answer, going from referral to referral, treatment to treatment, or even just always seeking, what is it? What is it? There must be something wrong. Or even trying to legitimize your pain by doing this to the people in your life or to those treating it. Was it hard to feel like there was a clean diagnosis, or that you didn't quite meet all the check boxes for a specific diagnosis? Maybe you wanted a diagnosis, so it gave you an answer. Did you feel like your pain was a mystery? In your experiences, did you feel like a woman unempowered? Maybe you questioned whether you imagined it. Maybe you were mortified. You were mortified because you thought that others thought it was psychosomatic. Um, or you thought it must mean that you were damaged emotionally. These are, and I'm using phrases that I have heard from other women. It really does help to think about these things and write it out and try to see what is the narrative that my brain has, or that I'm giving my brain to sort of narrate this journey. And when I listened to how chronic pain affected people's lives and their stories, I began to understand that a key first step was helping them reconceptualize their pain with a new language, and to understand experiences, and especially to understand that this is not their fault. And I noticed that once people understood that pain is real, period, right? Exactly as you experience it, exactly as you describe it, pain is real. That once people understood that pain was their nervous system trying to protect them, and that sometimes that nervous system gets stuck in a place of feeling unsafe, everything changed for them. And we know that understanding your pain, science tells us that understanding your pain can actually change your pain, especially when you combine this knowledge with other tools and with some guided application, right? The very last pillar of my philosophy involves the word bioplasticity. Sounds like a big kind of sciencey word, but it's actually really simple. So my job today was to help provide you with the best map sort of for viewing where you've been, considering how that impacted you, what your narrative is, maybe even how you'll go from here. But the idea is that this is the first step of gaining some control over your narrative, is being aware of it, what impacted it, and gaining some control. And I'm going to say something here related to this pillar of bioplasticity that may be a little bit risky to say. Maybe it's kind of controversial, but what I want to say is that you're going to be okay, okay? Not to fear. You're going to be okay. And I say that because I don't think anyone says that. And I think these could be some of the most powerful words in the world of medicine and physical ailments. And most women have probably never heard that you are going to be okay. But how do I know that you're going to be okay? Well, I know this because bioplasticity. Bioplasticity is a term that basically acknowledges that all of the systems in our body have the potential to change, from our skin to our immune system to our muscles and our brain. The idea of these systems being plastic can be likened to the idea of, like plastic material being melted, recycled, molded into new shapes. With new demands placed on it repeatedly, our brain and our body systems can adapt and grow and change. Evolution has allowed this for our body systems. And so let's pull this all together. Instead of thinking of your car as I'm mixing this up. Instead of thinking of your body as a car with broken parts, you can think about your body as a car with 4 flat tires. One tool or approach is only going to pump up one tire full of air, especially if it's really limited, like a medication or a procedure. It might pump you up with a tire full of air, especially if you've had pain for years. It will still render you unable to drive or go anywhere. You've only pumped up one tire. And thinking about that, have any of your past treatments given you more than 25% relief alone, long-term relief? And have any of them even made your pain worse? Have any of them connected you again fully with your values, the people, the places, the things that hold meaning to you? Because your pain is unique and multifaceted, the combination of factors that impact you, the treatments, the therapy, the tools, the guidance, it also needs to be multifaceted and unique to you. And so you can get all of the education that you can find, you can seek it, you can move past even the biomedical, But applying that education to create your ideal day is still going to be unique to you. And so, again, when someone asks you to rate your pain on a 0 to 10 scale, I really encourage you to rephrase that. Excuse me, I encourage you to rephrase that. It's wintertime, so my kids are passing on all kinds of colds. But we've been pretty lucky this year. Excuse me. I'm going to start that again. So if someone asks you, how would you rate your pain on a scale of 0 to 10? I encourage you to rephrase that. Because if a treatment was working for you, or if you were doing well, you wouldn't be talking about your pain level. The people that I've worked with that have gotten better, and I watch them get better, let's say over like the 3-month period, or that first 3 months that they're with me, they talk about their pain at the beginning, they talk about their pain levels at the beginning, how bad it hurts. But over time, they start to talk less about that. They start to talk more about the things they started doing, even if it was just a little bit. They start talking about the people that they've been seeing. Their life just starts to get a little bit bigger. And so their pain isn't a thing that stands out to them as much. And I'm not there giving them a quick fix to their pain or even claiming to make it go away 100%. I'm there to help them make their life bigger. And that is when people get better. It isn't when their number on a scale of 0 to 10 goes down. That is not the only thing that helps people recover from pain, and it doesn't acknowledge the entire experience of pain. You would be talking about, instead of 1 to 10, you'd be talking about how confident you feel in approaching your day. On a scale of 0 to 10, how confident do you feel approaching your day? On a scale of 0 to 10, how well are you sleeping? On a scale of 0 to 10, how connected do you feel in your relationships? Did this procedure, this medication, this shot, this program, this tool, 0 to 10, how much did it connect you to the things that are meaningful to you? And how can you participate 0 to 10? Are you able to participate in regular movement without causing a flare up, right? I know these are the things that are important to you. Am I going to lose my voice before we finish this training? But this is how you know that something is working, right? This is how we treat pain. I'm going to take a second here to just kind of look at some of the questions and drink my water. And the word intractable has shown up in the chats. And I think people are given that word in a lot of different ways, like we don't know what this is, we can't find the cause, there's nothing medically we can do about this. I think some people might even be given the word like this is psychosomatic. I think intractable is a word that, again, if you think about that word, does it provide your brain with safety, or does it provide your brain with evidence of danger, that there's something wrong that no one can treat? That's what that word can do for a lot of people. And we get really connected to these words that our providers use for us because they are at the top of the food chain treating our pain. And so what does that do for someone when they hear, I have a diagnosis that's intractable? And I can't tell you how many people that I worked with that had been told their pain was intractable, their diagnosis, they would have it forever, right? And I think it's important for people to understand the longevity of what they're looking at, or the medical field's ability to directly target something, right? That's all important. I'm not poo-pooing that. But there are also people with intractable pain conditions, or pain that won't go away, or pain that's lasted for years, or a diagnosis that someone may always have, that engage in learning and application of these things. And they can find that their life becomes bigger than their pain, that their pain stops being the thing that dictates their life. And so I think that's kind of what this training was about. Gosh, it's really hard to talk today. Was hear this language that you've been given. Has anyone believed that your pain is real, or told you that your pain is real and validated that experience? Have you been made to feel that your body is a machine, your pain is a broken part, and we just have to keep trying to figure out what the problem is or what the fix is? Has anyone talked to you about this role that your brain plays, that, okay, I'm telling you this information, but I also want you not to fear, right? I want to give your brain credible evidence of safety at the same time that I educate you about your pain. Or has your brain been receiving these messages that are triggering signs of danger? And if that's happened, that's okay, but it's important to understand, like, what is my narrative that I've developed? What have I been told? And with that remaining in my brain, what is that feeding into my pain cycle as part of a biopsychosocial experience, as part of my own context? And, the point of this is also to instill hope, right? That our bodies are bioplastic. They are meant to adapt and change, that they can change. Strokes, I think we talked about this a couple weeks ago. Strokes are a great example of this. People can completely lose the ability to walk and then retrain it back. So there's a dark side to bioplasticity. Our brain gets better at protecting us. Our brain can become overprotective. Our body can become more sensitive. It can feel unsafe for a while. That's not your fault. That's your brain and your body trying to like do its job and protect you. But we can recalibrate that with new experiences, understanding the narrative, and finding a new perspective and a new sort of language to understand pain and what we can do about that. And before we conclude today's session, I really want to extend, as always, a personal invitation to those of you who are ready for a more individualized approach. If you've been nodding your head along with me or feeling kind of excited, and maybe you've heard some of this knowledge before, but you've never, and you've tried to DIY it all this time, but you feel like I could really use some guidance on this education I've gathered for myself, or you're wanting new education, you're envisioning sort of this life that's bigger than your pain, I would love to connect with you personally. This is sort of my mission. I just want to connect with women and help them understand and feel and have this experience that they can be okay, and give them back sort of the control. So if what you've heard resonates with you, you're ready to apply some of these concepts in your own life, please let's book a call. Just DM me and I will immediately schedule an appointment with you or send you my calendar link. Especially if you're curious about what working with me might look like or what happens inside my group course, it's a totally no pressure call. I actually just like to call it a connection call. It's free, it's complimentary. So if you're interested in that, just send me a DM, or you can even comment me in the chat box for this training, and I'll get in touch with you to schedule that appointment. Also, stay tuned for those of you listening live or catching the replay shortly after this. I have some really exciting news coming up. Please let me know if you have any questions. I am here. I am genuinely here to support and guide you through this journey. Thanks so much for joining me today. I'll talk to you all soon. Okay?